To the Kanski lecture series Eyelid part 13, and in this part we are going to cover about the congenital malformations. So these are malformations that can be the normal and sometimes they are problematic. So epicanthal fold is basically the fold that is arising, for example this is eye, that is arising from the medial side of the eyelid, from the lower portion, or it can be from the upper portion. When it's from the lower portion, it is called epicanthus inversus. Apicanthal folds are bilateral vertical folds of the skin that extend from the upper and lower lids towards the medial canthi. They may give rise to pseudo-esotropia. The fold may involve the upper or lower lids or both. Lower lid fold extended upward to the medial canthal area, epicanthus inversus, are associated with the blepharophimosis syndrome. So, epicanthal folds are associated with the condition known as blepharophimosis syndrome. Treatment is with the Y, V, or Z plasty if necessary. So, you can see this is a 2.80 is showing the epicanthus inversus. So, you can see the vertical fold that is extending from the lower lid upper to the medial canthus. Then there is a telecanthus. Telecanthus is an uncommon condition that may occur in isolation or in association with the blepharophimosis and more systemic syndrome. It consists of increased distance between the medial canthi due to abnormally long medial canthi tendon. It should not be confused with the hypertaylorism, in which there is a wide bony separation of the orbit. Treatment involves the shortening and refixation of the medial canthal tendon to the interior lacrimal crust and or insertion of the transnasal suture. So basically, in case of a telecanthus, so for example this is eyes, the medial canthal tendons are very long. So because of this, it will give the appearance of the uh, increased distance between the medial canthus, and that is why IPD, which is IPD is basically the interpupillary distance. Interpupillary distance is basically the reflexes between the both eyes, and the distance between them is called the IPD. In case of the telecanthus, the IPD, usually the IPD is almost the distance between the medial canthi is almost less than half of the IPD. But uh, in case of the telecanthus, the distance between the medial canthi is greater than half of the IPD. And we can do if the surgery in which there will be the shortening and refixation of the medial canthal tendon to the interior lacrimal crust, or insertion of the transnasal suture. So you can see this is a telecanthus, and there is a long medial canthal tendon, and it is giving an appearance of the wide separation of the eye. Next is a blepharophimosis and epicanthus inversus syndrome. So, blepharophimosis and epicanthus inversus syndrome (BPES) is a complex of the eyelid malformation consisting of the moderate to severe symmetrical ptosis with poor levator function. So, as the name suggests, it will have the ptosis, which will have a poor levator function. It will have a telecanthus, it will have the epicanthus inversus, and it will have a small palpebral fissure. Other minor facial anomalies are commonly present. Inheritances with the usually autosomal dominant. Both PPES type 1 with premature ovarian failure and BPES type 2 without premature ovarian failure are caused by the mutation in the FOXL2 gene on chromosome 3. So this is important. There are two types of blepharophimosis syndrome, 1 and 2. The one is with the premature ovarian failure syndrome, and 2 does not have it. And basically it is on the LOXL2 gene. This is a very important question, gene, and an MCQ's part. Treatment initially involves the correction of the epicanthus and telecanthus, followed by the lateral bilateral frontalis suspension. It is important to treat amblyopia, which is present in about 50%. So first you have to treat the epicanthus and telecanthus, and then you have to treat the ptosis with the bilateral frontalis link suspension. Why? Because it has a poor levator function. Epiblephron. Epiblephron comprises an extra horizontal fold of the skin stretching across the interior lid margin and is commonly found in individuals of the Eastern Asian ethnicity. The lashes are directed vertically, especially in the medial part of the lid. When the fold of the skin is pulled down, the lashes turn out and the normal location of the lid becomes apparent. It should not be confused with the much less common congenital entropion. Treatment is not required in the majority of whites because spontaneous resolution with age as usual. Persistent cases may be treated surgically. So in cases of epiblephron, so there will be the uh, extra fold of skin that is present on the interior lid margin. So what will it cause? It will cause the inversion of the lashes, and basically with age it settle down, but sometimes the surgical correction is necessary. So this is also showing us blepharophimosis ptosis syndrome. Dominantly inherited blepharophimosis, child, grandfather and father have undergone surgery to correct the defect. So basically it is an autosomal dominant condition. Next is the congenital entropion. Upper lid entropion is usually secondary to the mechanical effect of the microphthalmos, which causes a variable degree of upper lid inversion. Lower lid entropion is generally caused by the maldevelopment of the inferior retractor aponeurosis. Treatment is involves the excision of the strip of the skin and muscle and fixation of the skin crease to the tarsal plates. So congenital tropion is basically due to the defect in the inferior retractor aponeurosis, and one of the how to treat it is with the HOTS procedure. So you have to name the remember the name of this important surgery. Why? Because it involves the excision of the skin and muscle and then fixation of the skin crease to the tarsal plane, and which is known as HOTS procedure. So coloboma is basically a defect in the eyelids. That is because incomplete closure, lids closure. A congenital coloboma is an uncommon unilateral or bilateral partial or full thickness eyelid defect. It occurs when the eyelid development is incomplete due to either failure of migration of the lid ectoderm to fuse the lid together, or to the mechanical forces such as amniotic band. Coloboma elsewhere in the eye, as well as a range of other association, may be present. The treatment of a small defect involve the primary closure, while the large defect may require skin graft and rotation flap. So basically, you know that it is usually associated with embryology. Basically, when the optic vesic cup is formed, so it's like this, and it closes, and it closes. ठीक? So when it closes, sometimes it does not close, maybe due to an amniotic band or failure of the closure. It can lead to the coloboma formation. It can be the eyelids that can be involved, it can be iris, it can be optic nerve as well. So upper lid colobomas, so there can be the upper lid colobomas and the lower lid colobomas. The upper lid coloboma is associated with the condition known as, very important condition known as, golden heart syndrome, whereas the lower lid coloboma is associated with the Treacher Collins syndrome. Upper lid colobomas occur at the junction of the middle and the inner third. The relative strong association include cryptophthalmos, uh, facial abnormalities, and the golden heart syndrome. So we will discuss this golden heart syndrome in the coming topics of the orbits. Basically, in a case of upper lid coloboma, the lid defect is basically at the inner one third and the middle third of the eye. But in case of the lower lid coloboma, it is usually the outer third that is affected. Lower lid colobomas occur at the junction of the middle and the outer third and is frequently associated with the systemic condition. Treacher-Collins syndrome, mandibulofacial dysostosis, is a genetically heterogeneous condition characterized by the malformation of the derivatives of the first and the second brachial arches, principally mandibular and ear anomalies. Lower eyelid coloboma is a feature. Ocular anomalies also described include slanted palpebral aperture, cataract, microphthalmos, and lacrimal atresia. So basically, in case of the Treacher-Collins syndrome, there are several brachial arches, that is related to embryology, and the first and the second brachial arch is malformed, and basically it includes the mandibular and ear anomalies. But in case of eye, it includes lower eyelid coloboma, it includes the slanting palpebral aperture, cataract, microphthalmos, and lacrimal atresia. So you can see figure 2.85, it is showing the upper lid coloboma, which is at the inner one third and the medial third, and the lower lid colobomas in a Treacher-Collins syndrome. So this is C is showing the Treacher-Collins syndrome. There is a mandibular and ear anomalies in this. Cryptophthalmos is a rare congenital anomaly in which the eyelids are absent, replaced by the continuous layer of the skin. So in case of the cryptophthalmos, you will not see the eyelid. There will be the skin that will be present in front of the eye, and it can be complete and incomplete as well. The complete cryptophthalmos or microphthalmic eye is covered by the fused layer of skin with no separation with the lid between the lids. Incomplete cryptophthalmos is characterized by the rudimentary lids and microphthalmos. So their incomplete may have some rudimentary lids. Fraser syndrome is a dominantly inherited condition in which the cryptophthalmos is a common finding. Other features include syndactyly, urogenital, and craniofacial abnormalities. So syndactyly means the fusion of the fingers, and there will be the urogenital and the craniofacial abnormalities. So you can see figure 2.86 A and B. So A is showing us a complete skin closure, and in B is showing the rudimentary lids. Then there is a euryblephron. Euryblephron refers to the horizontal enlargement of the palpebral fissure with associated lateral canthal malposition and lateral ectropion, which may result in lack of thalmos and exposure keratopathy. So just remember that a congenital ectropion occurs in three conditions. Almost most common are the three conditions. Number one is that euryblephron. Another one is ichthyosis. And other one is Down syndrome. So euryblephron is basically there will be the horizontal enlargement of the palpebral aperture, and there will be the ectropion, lateral ectropion, which result in exposure keratopathy. Microblephron, blepha mean eyelid, so microblephron means the eyelids are small. So microblephron is characterized by the small eyelids or often associated with anophthalmos. So this is a picture showing microblephron associated with anophthalmos, mean no orbit, no eyeball. Ablephron means that there are no lids present. Ablephron consists of the deficiency of the interior lamina of the eyelid. Treatment involve the reconstructive skin grafting. Ablephron microstomia syndrome is characterized by the enlarged fish-like mouth, ear, and skin and genital anomalies. So this is showing the ablephron. There is an absence of the eyelids, and B is showing us the following reconstruction, how the eyes look like, and there will be the fish-like mouth, ears, abnormalities as well. Congenital upper eyelid lid inversion. Congenital upper lid inversion is a rare condition most frequently seen in infants of the Afro-Caribbean origin in Down syndrome And in congenital ichthyosis, colloidal skin disease, it is typically bilateral and symmetrical. It may resolve spontaneously with conservative treatment or require surgery. Enchylopreform filiform adenitum. So basically, it is the skin tag that is connecting the two lids, and you just surgically excise this tag. In enchylopreform filiform adenitum, the upper and lower eyelids are joined together by thin tags. Most cases of sporadic treatment involve the transaction with seizure, usually without anesthesia. So that's it for the eyelid part 13. See you in the next lecture series. Thank you very much.